Ministers, colleagues, it's my pleasure to join you at the 2025 Global Digital Health Forum. Medicine is a universal language. The anatomy of a patient in Addis Ababa is identical to a patient in Washington, D.C. And surgical excellence is universal, but access to it is not. We have tried to bridge this gap with buildings and equipment, but the critical gap we have today in surgery is not a lack of scalpels. It's a lack of data-driven insights. Look at these two operating rooms. On the left, in Addis Ababa, learning how to use a camera to perform a minimally invasive brain surgery. And on the right, a very similar scene. Both are filled with talent, but both are wasting our greatest opportunity, video data. Every modern operating room can record video. That data is often deleted or locked away. This hidden data prevents surgeons from learning, slows knowledge, and creates risks of bias. If we only look at information from high-income countries, it won't meet the needs of our patients around the world. We need data for both of these theaters to build a system that works for everyone by making great surgery universally available. My name is Dr. Daniel Donoho, founder of the Surgical Data Science Collective, where we are using data science and artificial intelligence to close the global surgical divide. The global surgical divide has created a massive need to strengthen our health systems. More than 160 million operations are needed but not performed, and 3 to 5 million people die every year within 30 days of surgery. According to The Lancet, if we considered surgery as a disease instead of as a treatment, surgery itself would be one of the top causes of death globally. This need arises from a major challenge in how we train surgeons. The reason we can't fix this faster is because our training model for surgeons hasn't changed in the last 100 years. This see one, do one apprenticeship model requires physical presence, one-on-one engagement, extensive travel. We simply can't train the hundreds of thousands of new surgeons that we need this way. And even if we did, they would only replicate the divide that we already have today because they won't be able to learn from this missing information. At Surgical Data Science Collective, we're using digital tools to reverse this math. Each surgeon that we train can benefit 10,000 lives. In the old model, we would simply say to train more surgeons. But in the new model, if we turn their expertise into data, each of those new experts, each of those trained surgeons can scale. They can train residents and trainees more effectively. Their learnings are shared across the health system. With every procedure that's performed, a health system gets stronger and smarter. Digital assets are created that make the next surgery better. Each surgeon's expertise can impact not just the 10,000 patients they may individually treat, but millions of lives, both now and in the future. This is the promise of surgical data science. We don't have to choose between quantity and quality. By using artificial intelligence to understand videos like these from the operating room and continuously upgrade the workforce, we can push both curves upward simultaneously. The way that our platform and our approach works is we start with local stakeholders to understand their needs, and we develop solutions with them based on data from the local health system in combination with data that we've acquired from around the world. These local needs guide the creation of insights that are then deployed as training, as research, but most importantly as learning and as care improvement. Subsequently, those findings are published, the models are made available, and the wheel turns again for the next big problem. We currently work with more than 500 surgeons around the world and dozens of researchers in more than 59 countries. But I want to close by diving into just one of those engagements. We have an upcoming partnership with the Ministry of Health in Ethiopia, where we plan to distribute this kind of surgical training program throughout their workforce development process. We want to integrate artificial intelligence into how we share surgical knowledge so we can train surgeons faster, continue to have them improve over the course of their life, and close the global surgical divide. To all of our stakeholders, wherever you may be, to the ministers, to the doctors, to the advocates, you've digitized your cold chains. You're digitizing your health records. Meanwhile, your surgeons are performing miracles in the dark. We can use surgical artificial intelligence and data science to turn the lights on. I invite you to join our collective, and together we will close the global surgical divide.